I've had two wonderful mentors in my life that have led me down the paths that my career has taken. The first one was a Dr. Abass Alavi, who was the chief of nuclear medicine at the University of Pennsylvania, where I went to medical school and did a lot of my training. I had an opportunity to work with him for a full year while I was actually in medical school, and he introduced me to the whole world of functional brain imaging, nuclear medicine, and gave me the basis for being able to explore the mechanisms of so many different kinds of diseases, as well as various integrative medicine practices, so that we could understand exactly how our brain and the various issues and problems that we face interact. So he was also incredibly generous and encouraging. Whenever I had a bit of a crazy idea, he was always all for it and encouraged me to try to find the most effective and the most specific and scientific way of trying to find an answer to my questions, usually using some kind of nuclear medicine imaging, some kind of functional brain imaging technique. The other important mentor in my life was a Dr. Eugene, who was a psychiatrist and also an anthropologist by training. He also was at the University of Pennsylvania. I actually met him around the same time that I had met Dr. Alavi. Dr. DeQuille had been very interested in the relationship between our brain and specific kinds of beliefs, typically religious and spiritual beliefs. And he had been exploring this relationship back as early as the 1970s. I came to meet both of these individuals around 1990. And with Dr. DeQuille, I began to explore in more detail the relationship between the brain and our psychological and spiritual health. We explored a variety of different practices like meditation and prayer, and what might be going on in the brain when a person is engaged in those practices. And finally, the two of them, within my own ways of thinking about it, we all met up and started to talk about how we might be able to push this whole field forward. And the proverbial light bulb went off in my head where I said, well, if we're using these functional brain scans to look at Alzheimer's disease and depression, why can't we use them to look at spirituality, religion, and many other aspects that go into integrative medical care, including interventions such as acupuncture, yoga, and many other approaches that include things like nutrition and antioxidant effects. So this is what has really led me to where I am today as the Director of Research at the Marcus Institute of Integrative Health and in the Department of Integrative Medicine and Nutritional Sciences here at Thomas Jefferson University.